Multiple sclerosis (MS) is a chronic disease of the central nervous system, CNS, which consists of the brain and spinal cord. It occurs when the immune system mistakenly attacks the protective covering of nerve fibers, known as myelin, causing inflammation and damage. This disrupts the normal communication between the brain and other parts of the body. There are several types of MS, which are characterized by how the disease progresses. 1. Relapsing-remitting MS, RMS. The most common form of MS, characterized by periods of relapses, or flare-ups, followed by periods of remission where symptoms improve or disappear. In relapses, new symptoms appear or existing symptoms worsen. The remission phase is marked by recovery or stabilization of symptoms. 2. Secondary progressive MS, SPMS. Initially starts as RRMS, but later transitions into a phase where the disease steadily worsens, with or without clear relapses. Patients may experience a gradual accumulation of disability. 3. Primary progressive MS, PPMS, characterized by a gradual worsening of symptoms from the beginning without periods of relapse or remission. It is less common than RRMS and tends to be more debilitating. 4. Progressive relapsing MS, a rare form of MS characterized by progressive worsening of symptoms from the outset, combined with occasional relapses. Symptoms of MS can vary widely, depending on the part of the CNS affected. Common symptoms include numbness or tingling in the limbs, face, or other parts of the body, fatigue that can interfere with daily activities, weakness or difficulty walking, vision problems such as blurred vision, double vision, or pain in one eye, optic neuritis, muscle spasms or stiffness, balance and coordination issues, cognitive changes including memory problems and difficulty concentrating, pain, including neuropathic pain such as burning or shooting sensations, bladder and bowel dysfunction, depression or mood changes. The exact cause of MS remains unknown, but it is believed to be the result of a combination of genetic and environmental factors. Some potential risk factors include genetics. MS can run in families, and having a first-degree relative with MS increases the risk. Geographic location. MS is more common in regions farther from the equator, which suggests that lack of sunlight and vitamin D deficiency may play a role. Age. MS typically affects people between the ages of 20 and 40. Gender. Women are more likely to develop MS than men. Viral infections. Certain viruses, such as Epstein-Barr virus, EBV, have been linked to an increased risk of developing MS. Immune system dysfunction. MS is considered an autoimmune disease, where the body's immune system mistakenly attacks its own tissues. Diagnosing MS is often challenging because its symptoms can mimic other conditions. A diagnosis is made through a combination of medical history, a thorough evaluation of symptoms and family history, neurological examination, testing reflexes, muscle strength, coordination, and eye movements, MRI, magnetic resonance imaging, imaging of the brain and spinal cord to detect areas of myelin damage, lesions, lumbar puncture, spinal tap, analyzing cerebrospinal fluid to detect abnormalities associated with MS. Evoked potential tests, measuring the electrical responses of the nervous system to stimuli. While there is no cure for MS, treatment focuses on managing symptoms, reducing relapse frequency, and slowing disease progression. 1. Disease-modifying therapies, DMTs. Medications that modify the course of the disease by reducing relapses and slowing progression. Some common DMTs include interferon beta, glatiramer acetate, fingolimod, ocrelizumab, natalizumab. 2. Steroids. High-dose corticosteroids, such as methylprednisolone, are often used during relapses to reduce inflammation and accelerate recovery. 3. Symptom management. Specific treatments are used to address symptoms such as fatigue, muscle spasms, pain, bladder issues, and depression. For example, muscle relaxants for spasticity, pain management with analgesics, antidepressants for mood disturbances. 4. Physical and occupational therapy to help improve mobility, strength, and daily functioning. 5. Lifestyle modifications. A healthy diet, regular exercise, and stress management are important components in managing MS. The course of MS is highly variable. Some individuals experience only mild symptoms and periods of remission, while others may have progressive disability. MS does not typically shorten life expectancy, but severe cases can lead to significant disability, including the need for a wheelchair. With early diagnosis and appropriate treatment, many people with MS lead active and fulfilling lives. Ongoing research into the causes, progression, and treatment of MS is promising. Advances in neuroimmunology, stem cell therapy, and neuroprotective treatments are some of the exciting areas being explored. Clinical trials continue to develop new medications that may provide better management and potentially a cure. If you or someone you know is experiencing symptoms of MS, it is important to consult a healthcare professional, preferably a neurologist, for an accurate diagnosis and personalized treatment plan.